that, you know, one of the things that I thought was missing most in, I've been working in residential addiction treatment for the last 10, 12 years, and I think that what was most alarming to me when I started my own program in South Florida called Next Chapter, we treated men with addiction and trauma issues, was, the gap. One of the major gaps that I saw in working in the field was the lack of focus and attention on trauma and how trauma plays such an important part in the addictive process. There's a buzzword out there, trauma-informed care. But I think that what we do and what was missing is really integrating treating trauma as part of the treatment for addiction. And when I say trauma, trauma is a big word. It's a widely misunderstood word. We're really talking more about some of the more covert trauma that happens in childhood. Some of the things that people really don't understand or see as a significant event. And we really look at how some of that earlier childhood wounding, neglect, abandonment, and of course, physical, sexual abuse, how that really drives the addictive process. And that's something that we really specialize here at All Points North.
Trauma can come at any time in a person's life. It could be an adverse childhood experience, as Abe says. It could be trauma from the battlefield. It could be trauma from a horrible natural disaster, having survived, a hurricane, a tornado, something that was massively destructive and frightening and scary. It could be trauma that occurs later on in life in an adult relationship where a person is psychically abusive to another or physically abusive to another. Trauma comes in many, many forms. It could be an accident. It could be so many things, but it's something that stays with you and it wounds you, and it can cause you to seek relief. It can cause you to seek to medicate that pain or that wound with something that makes you feel good. And because we are programmed as human beings to survive, and the survival center of the brain is the same place in the brain where our reward system is. And addiction is a disease of reward system dysfunction. Among other things. It is many things, but it is definitely a disease of reward system dysfunction. So we have to be sensitive to that. And when Abe talks about trauma-informed care, it means that when we take care of people, we have to always look at it through the lens of trauma, to understand that you can't treat what's going on in isolation without understanding where is the pain.
There's been, I think, as Abe alluded to, a long sort of rule of thumb in the field in substance abuse treatment to not touch trauma, and that I think applies to like acute traumas. And in some ways that makes sense based on the amount of time that a person can spend in care. If somebody's in residential level of care and they're likely to only get a few weeks of coverage, that may very well be something to consider, but that's really one of the advantages that we offer at All Points North Lodge, is the ability to have a continuum of care and the ability to have somebody here throughout multiple levels of care and be able to address the trauma, not just the acute major traumas, but the relational trauma or the developmental trauma that almost always factors in with severe addiction.
And I think it's important to make a distinction between treating PTSD and what we're talking about as trauma and relational trauma here. They can go hand in hand, but when looking with someone who has a diagnosis of PTSD, there may be events that are specific, that they're reliving, having reactions to, not being able to really survive in their current environment based on some specific past experiences, and those are things we need to treat. But oftentimes people will ask, well, what is trauma and who has it? And I would say everybody. And I would say that it's when we make it more a broader definition of what trauma is, when we look at wounding or stressors, then we could say underlying issues, that those are the things that lead to addiction and other strategies that people use to cope. And some of it, like Abe was saying, is very covert, and we might not see it as trauma. Like someone who had to become very uncontained emotionally to get attention when they were a child, or they had to be contained very emotionally when they were a child, or maybe they needed to seek out attention or not seek out attention just to be able to get along. And then those strategies, if the woundings or the stressors that led to those in their families of origin specifically were not resolved, they can be left with those strategies. So as adults, they're still applying them to current situations where it might not work. As a kid, maybe you had to scream and yell to get attention. But as an adult, screaming and yelling to get attention doesn't really bode well in relationships. And that's the kind of stuff that then leads people to being like, you know what, I don't really seem to fit in. I don't know how to survive. I don't know how to live. I can't really get to the place that I want. And then they'll start, maybe it's drinking, or maybe it's drugs, or maybe it's sex or gambling, or some sort of strategy that they're using to kind of alleviate the stressors that have been caused by them trying to employ strategies that help them in their earlier years that no longer are really effective. You know, often they're survival strategies that have become maladaptive.